said, it's a very different world where you apply general to specialized AI tools. The second one is, and that's actually a very interesting challenge, can we explain how the solution actually works? Do we actually able to say how, for example, an answer comes about? We talk about that later because it's very, very important in clinical use cases to ensure that these are trusted solutions. So traceability, for example, of the evidence is very, very important. How can we explain how the answer comes about? And especially healthcare professionals who always make the decisions, they need to be able to trust that answer that comes about. They need to understand where it's from. And I was very excited to hear, for example, that from a medical education perspective in India, now AI trainings are mandatory, which is, I think, an incredible step forward. Solution. Very, very important. Then we talked about bias briefly, how we can help to prevent bias. And bias starts actually at the very first step when a clinician asks the question to the AI tool in the way of how they ask the question. So what you include in the question that you ask and what you exclude in the question that you ask can make a huge difference. I think you all experience it when you use your AI tool, when you prompt. It makes a huge difference how you prompt, how you ask the question. And then last but not least, it's about respecting privacy. It's about, especially in healthcare, again, the data that you share with the tool should really be, it should, while there can be utility of having that data help to improve the product, we need to ensure that privacy is respected, that the data is not shared broadly, not shared for different purposes. It always needs to be along the intended use of the solution. And what we have worked on are these five principles when we design our offerings, and these are the kind of things that I think are very important and are also very similar to when you think about the principles I think that are laid out also by the AI conference overall. Very, very important, very, very good links here. Yeah, that's all from my side.
Thank you, Dr. Yan. I think you spoke about accountability and ownership, human in the loop, very important element for responsibility. And in fact, there are 9 principles which have been globally accepted. Providing equity and care in a manner which doesn't harm the patients also. Right? I mean, the technology can go both ways. It's a double-edged sword. And I think that's where the use of responsible AI technical aspects is quite critical. Dr. B. Srinivas, sir, I would like to come to you and I would like to sort of hear from you. So addressing equity, I think in healthcare requires medical education. I think that's a key component to ensure that we have regular access of doctors and healthcare professionals in India. A lot of them are now getting upskilled when it comes to the use of AI. Would like to understand from you, sir, what is the role of responsible AI and where is the government looking at responsible, sort of really imparting the understanding of using AI responsibly when it comes to primary health centers or even at hospitals and other patient care units to ensure that we maximize the use of the technology without harming the patients. We have to get your thoughts on that.
Good morning, all of you. Thank you for inviting me here. So the biggest you can see when we entered the entry of this the conference room itself, we had a lot of people there, And in medical education, as you all know, when the students give the NEET exam, we have approximately 25 lakh students giving the NEET exam across the country, and we have only 1 lakh seats. But recently, when we were in the NMC, and the ministry is really committed to increasing the number of seats. One thing that comes to the challenge is, even if we increase the number of seats and also the number of medical colleges, if you look at the number of medical colleges when we were studying MBBS, they were around only 30,000, seats of 30,000. Now it's increased to 1,18,000 MBBS seats. And medical colleges were around only 100 or 200. Now we have reached almost 800. So, but the biggest challenge right here is that even though we have increased the number of medical colleges, the opportunity for the students, especially from the rural areas, they are having a big challenge in getting good access to the e-books and the textbooks, as well as to the good technical material, including this AI material. So the government is thinking of using the leverage of AI to reach out to these students, especially in the aspirational medical colleges, which are lying in the districts, the rural areas. And in the National Medical Library, we have started the process of procuring the e-books and the digital clinical material. And we are giving to right now around 57 medical colleges across the country. Only the government, no, right now only 57. 57, but we are planning to scale it up slowly and slowly. And all of you know that there is an ONOS which was recently started, One Nation, One Subscription, where the government has taken up the stand that they are now going to give access to all the government medical colleges across the country, all the journals free of charge. We are in the pipeline to also include the private medical college later on. But since right now the budget is coming from the government budget, we are only right now concentrating on the government institutions as of now. But hopefully, when we increase this scope of digital content to across the country, we need, of course, responsible AI there, because the knowledge, if it is not well regulated or regulated in the right way, it may also have unintended consequences. So we have to ensure that, and I think we have to also see to it that whatever clinical or whatever knowledge we are giving out to our students, they are in the right knowledge that is being given. And of course, we would like to also increase in the recently in the National Medical Commission. We plan to have telemedicine also starting there, because many of the medical colleges they don't have this access to good faculty. Building the campuses is very easy. Building up the the infrastructure is very easy, but building up the the knowledge material, that takes time. And for that, we would like that good doctors or good faculty from across the world and also from AIMS, they should be able to give lectures in our NMC or NML, and that will be transmitted to all the medical colleges, so that with technology we can, as far as possible, of course, we cannot replace it. AI cannot replace the doctors, but it can assist them in the learning process in the future. So the government is in the right way, and I think the right path for that. But this is the process that we have started, and hopefully we will be able to do that much better in the years to come.
5000 kbps.
Thank you, Mr. Srinivas. I really like the point you mentioned about 57 government colleges, and we're already working to sort of instill digital education and teaching the doctors and
yes,
medical
life
professionals. Healthcare is one space which I feel
कोई नहीं है
strongly
सर
about in terms of the use case for generative AI, and we are I would like to go to Dr. Kar. So I would love to understand from you, and sort of for you, my focus is on affordability. Even at my context, I sort of spoke about the fact that affordability lies at the heart of India's healthcare challenges, right? And that's something which the government is increasingly working to bridge. Industry is playing a critical role in terms of making healthcare more affordable. Ayushman Bharat scheme is one such initiative by the Prime Minister of India. But there are other initiatives as well. Would love to understand from you how responsible AI or AI in general can help healthcare more affordable. And when I say healthcare affordability, it's a very broad term, right? It could mean basic diagnosis, it could mean having access to a doctor, it could mean having access to a general physician for something as simple as cold and cough, or it could also mean, surgical purposes or any other sort of kind of diagnosis which you have to do. So would like
conclusion to the strategic decision
causal framework. We have been working with predictiveness. We now need to move to the causal framework.
I mean, just to follow, because I think we have 30 seconds for you to say, and then I'll go to Dr. Chaudhary, the causality from, I mean, moving from predictiveness, because the tools right now, I mean, of course, they're great, but they're nothing but predictive softwares and pattern recognition tools at the end of the day. And we are not there yet in terms of AGI, which I think, Sam Altman will be here, you guys can hear him, and other big folks, Sundar Pichai and all will be here too, because they are saying that it's still 5 to 7 years away in terms of artificial general intelligence. Yeah, maybe few here and there. So speak about, because a lot of these causality parameters which you're speaking about, how accurate will they be for a doctor to assess and say, okay, I don't have 5 options, I have only 2 options. At least make it more narrow for me to make a decision.
This is a favorite question of mine. We always talk about AI in terms of accuracy. But look at medicine. Medicine is a probabilistic science, right? Medicine is all the papers you will see there, Science Direct and all, are all talking about sensitivity and specificity. They're not bothered too much about in terms of accuracy. But when it comes to AI, we want the accuracy. But your AI is as good as what the data that you feed, whether the data comes from your unstructured medical records or structured, medical literature. In all way, you will have to understand how contextual they are and how accurate they are. So to do an accuracy perspective in a probabilistic science is slightly difficult. And that's why we really require a bit of reasoning. That's why we require causal frameworks, where we are saying from a probabilistic fibers that this patient, if I give this drug or combination of this treatment, 6 weeks or 6 months is where we are.
This is great. Thank you, Dr. Kirk and Dr. Chaudhary. We sum up and would love to hear your thoughts in terms of the gender divide, and how do you see the role of responsibility in the next 5 years to bridge that in healthcare access?
Sure. Thank you so much. I think I want all of us to come back to the larger mission that the country has set, which is about happiness for all as well when we talk about AI. And I'm going to use a personal story here. While I was growing up as a student, I come from Karnal, a small town in Haryana, about 150 kilometers from here. And I have these fond memories of really going to a nearby small family clinic, husband and wife, who would probably be like my uncle and auntie, same age as my parents. And I think it was a seamless experience to really go to them whenever needed, as per the requirement. However, as I was pushed out of Karnal to bigger cities for bigger opportunities, for higher education, for work, finding a private clinic nearby is not a seamless experience anymore. I do understand that the goal for the healthcare system is to really deliver at scale, at quality. But I think what I really still miss from this whole healthcare continuum of care is compassion. I really would like to have some more compassion, some more empathy embedded into our healthcare ecosystem. In fact, the World Health Organization also just last year came out with a report saying that on compassionate healthcare, saying that compassion is the only transformative tool that can really take us towards better healthcare. So in my mind, I think this is a huge opportunity for us to see that how, as healthcare leaders, we can take a head and heart approach. We are able to really blend in the decision making, the technical, analytical decision making, alongside empathy and compassion to be able to provide good quality care. Because healthcare is at the end of the I think this is a huge opportunity for us to see that how we can leverage AI as a tool to really enable and empower healthcare workers at all levels, frontline workers, clinicians, and tertiary care centers, to really deliver care with more compassion and more empathy. So I think that to me we would be looking forward to see how this can also come up in the next few years for sure. Thank you.
And I think for compassion in AI, responsible use is a must, right? So while we all believe in, moving fast and breaking things in the tech space, that's the usual motto. I think when it comes to the use of AI, we should try to move fast but cautiously in terms of building in safety procedures, and nothing like building those 9 principles of responsible AI. But thanks a lot to our panelists. I think we have a minute. Can we take a question or two from the audience? Am I allowed?